Hello all, I'm Dr. Neema Bhat, Senior Consultant, Bone Marrow Transplant Physician and Pediatric Oncologist. And I'm talking to you from Therrapie, Hematology and Oncology Clinic and Daycare Centers, which is a new daycare center built on the lines of daycare centers in the US for a long time now. Today, I'd like to talk to you about a topic that is blood disorders in children. So I'm a pediatric hematology and oncologist in addition to being a hematologist for adults. And we see a lot of blood disorders in children that are now being picked up because we are paying more attention to their symptoms and we have much better tests to diagnose these blood disorders or blood conditions. So what are the main blood disorders or blood conditions that we see in children? One of the main things as children grow up right from their infancy to being toddlers and as they grow into older childhood, especially during the toddler phase, what we see is severe anemia or iron deficiency. Now, why does this happen? This happens because most children depend on milk as a primary source for their nutrition, and because of which their intake of solid foods is much compromised, and they're not able to get sufficient iron or vitamin B12 or various of the other vitamins that are required for blood production. That causes most of these children to have iron deficiency anemia or anemia because of other nutritional issues or disorders or deficiencies. What would you do to be able to prevent iron deficiency or deficiency anemia in children? Make sure that they take a wholesome, balanced nutrition and diet, and make sure that the milk intake is limited to only about 1 or 2 glasses per day so that they have a good appetite to take plenty of green leafy vegetables, legumes, sprouts, some meat products, and a variety of food items basically, and they don't overeat or overconsume milk. Apart from anemia, we see children who have blood disorders right from their birth. This is called thalassemia or sickle cell anemia, where your ability to make normal red blood cells is significantly compromised. We also see patients with ITP, which is a condition where platelets are low and because of the overactive immune system and requires treatment because of the high risk of bleeding when platelets are very low. We see patients with conditions we call aplastic anemia in children, where the bone marrow is severely compromised and they're not able to produce all their normal blood counts. We treat patients, pediatric patients with leukemia, which is blood cancer, also lymphoma, which is another type of blood cancer. Leukemia is one of the most common cancers in children, but also a very treatable disorder. And even though it's a cancer diagnosis, it's one of the conditions with prognosis or outcome as good as about 90 to 95% if treated in the right way by the right specialist, of course. Apart from this, we also diagnose patients with immunodeficiencies. So we get a lot of babies, who have had recurrent fevers multiple times during their infancy when they're growing up, have had ear infections, lung infections, skin infections, abdominal infections. So some of these children can be born with what we call immunodeficiency disorders, where the proteins in our body called antibodies are on the lower side. The cells which are important to fight infections, which are part of our immunity, are compromised right from birth. And most of these patients can actually be saved from death if they're diagnosed at the right time and treated appropriately for these medical conditions. Also, apart from this, we see patients who have bleeding disorders. So we have patients who have clotting factor deficiencies. It's called hemophilia, factor 7 deficiency, and various other blood clotting factor deficiencies. There are some children who also come with a higher risk of blood clots. Although the number is much lesser when compared to adults, these children also need to be diagnosed and treated at the right time. Children sometimes require bone marrow aspiration biopsy when we have a doubt if they have either aplastic anemia, sometimes if they have autoimmune conditions, sometimes if they have ITP. We need to rule in or rule out, other conditions by doing a small procedure called bone marrow aspiration biopsy. And this is also performed here by a pediatric hematologist, of course, with the help of our anesthetist colleagues, because we need to sedate these children for a painful procedure like a bone marrow. Apart from this, we also treat pediatric oncology, of course, which I'll be talking about in my future videos. If you have any questions regarding the blood-related health of your child, anything related to low counts or high counts, whether it can be hemoglobin, WBC, or platelets, whether it is questions about if your child is, properly immune or if their immune system is working normally, if your child is having recurrent fevers or recurrent infections, please feel free to reach out to us at Therrapie Hematology and Oncology Care, and we would be delighted to help you in any which way.